Hello, everyone. We would like to welcome you to today's webinar, What You Need to Know About the European Medical Device Regulations. Our focus today will be regarding labeling, but let me explain to you at the beginning what we initiated as housekeeping items. Your lines are automatically muted, but of course you can address questions. Please use the Q&A box which appears to you, and at the end we will return to those questions that came during the session as well as at the end of the session. The people who are running this webinar for you today are, on the one hand, myself personally. My name is Jutta Hohenhurst. I am from the company Schlafender Hase. And as a keynote speaker, we have today Maketa Nabiani with us. She is an expert in labeling. She has more than 10 years experience in labeling in pharma and the medical device industry, and is today an independent consultant for product labeling and packaging. Maketa, thank you very much for joining us today, and I would like to hand over to you.
Thank you, Jutta, and welcome everyone to this webinar. I'm happy to see that so many participants dialed in, and I look forward to sharing some of my experience and to introducing this interesting topic to you. What we are going to look at today is the current status of the EU Medical Device Regulation, the definition of label and labeling. We will explore the complexity of labeling and see what are the most expected and most frequent IFU updates. Furthermore, we will take a look at what the MDR says on promotional material and advertising, as well as on human factors. And we will also take a look what does MDR say to the use of graphical symbols. Furthermore, we will explore the need for consistency in labeling and across technical documentation. And of course, as we are in the European Union with 24 official languages, we will take a look at the language requirements. Finally, we will take a look at how to accelerate steps towards the MDR labeling compliance. So the Medical Device Regulation was released in May 2017. It superseded the existing Medical Device Directive. The regulation will be enforceable by 2020 and introduces a number of obligations that legal manufacturers have to fulfill. The MDR regulation emphasizes safety, transparency, and control, and has significant impact on labeling. On the next slide, you will see the timelines. So as mentioned, the MDR entered into force in May 2017 with the date of application in June 2020. The labeling deadlines are not so obvious, and they actually have to be interpreted from the other deadlines. So the first deadline that was supposed to impact labeling was the deadline of EUDAMED going public, the European database for medical devices that was planned for June 2020. However, the EU is struggling setting up this database, and the date of going public was postponed to May 22. So this is when labeling content must be MDR compliant. This is actually a good date because this is also a date when the European certificates of conformity that were issued before May 2017 expire. So it's a good timeline to get labeling in order. As said, the MDR emphasizes the patient. It emphasizes high-level protection of health for patients and users through high standards and quality. And the overarching goal is the protection of public health. Before we dive deeper into the subject of labeling, I would like to draw your attention to the terms label and labeling for the sake of clarity. For this purpose, I'm borrowing the definition of the term label from the US Code of Federal Regulations that says that label is a display of written, printed, or graphic matter upon the immediate container of any article. Actually, this definition has been existing for a while, and it gave some basis to the definition of label as per MDR, which you can see on the next slide. MDR is saying that label is the written, printed, or graphic information appearing either on the device itself or on the packaging of each unit or on the packaging of multiple devices. When it comes to the definition of labeling, this is also a definition by CFR saying that labeling includes all labels and other written, printed, or graphic matter upon any article or any of its containers or wrappers, or accompanying such article at any time while a device is held for sale after shipment or delivery for shipment and after shipment in interstate commerce. Fact is that medical device regulation does not define the term labeling. However, as in many aspects, MDR refers to the International Organization for Standardization, the ISO, which actually defined the term labeling a while ago and says that labeling covers label, instructions for use, and any other information that is related to identification, technical description, intended purpose, and proper use of the medical device, excluding shipping documents, which is different to the definition by CFR. So why is labeling of significant importance? Although labeling is often being underrated for many different reasons, such as lack of resources or lack of budget, labeling is crucial when it comes to credibility of a medical device company. In fact, everything sooner or later shows in labeling. Labeling is related to every aspect of product life cycle. It identifies the device, identifies the manufacturer and its representatives, it describes the intended use, it introduces risks and warnings, introduces limitations and contraindications of a product, describes the device and performance, instructs on usage, maintenance, storage, is part of corporate identity when you, for example, think of promotional material, and last but not least, labeling content is demonstrating the full responsibility of the legal manufacturer. This slide demonstrates the complexity of labeling. You can see here some of the mentioned labeling items that may be and will be impacted by the MDR. So why is labeling critical is showed on this slide. We are all aware of what disastrous impact labeling can have on patient safety. Apart from that, there are costly product recalls, financial damages, damages to business reputation, negative impact on manufacturing and distribution, and non-compliance. On the next slide, we are going to take a look at the most expected and most frequent IFU updates. So what are the updates to be expected with the next MDR relevant revision? So I would absolutely recommend you to make sure that you identify your device properly, that you properly identify the manufacturer, that you provide information about safety and performance relevant to the user, that you clearly claim the risks, warnings, precautions, contraindications, clinical benefits, and limitations of use. If you have sterile products, think of proper information on sterile packaging and preparatory treatments. Make sure that the use of symbols is consistent in your IFU updates. Review all symbols and their explanations, and provide link to summary of safety and clinical performance. The summary of safety and clinical performance is a brand new document required by the MDR. We will elaborate this topic on one of the following slides in more detail. Also, you should demonstrate with your IFU when was the date of issue and the date of latest revision to make sure that the user gets the most recent version that includes any relevant updates. Also, your IFU should contain a note for the case of serious incident and where these have to be reported to the manufacturer and to the competent authority. And one of the other important requirements imposed by MDR is that IFU must be written in a language that is readily understood by the intended user, supplemented with drawings and diagrams. So on this slide, you can see highlighted the identification of manufacturer that must absolutely be in your labeling items. If the manufacturer is domiciled outside the EU, you must identify its authorized representative by name, address, and website. Another important topic for your IFU update is the intended purpose. MDR clearly defines what is the intended purpose and requires that intended purpose must be consistent across all mentioned labeling items. For those who have been already trading their devices in the European Union, you are most probably familiar with the CE marking. The CE mark is a certification that the product fulfills certain requirements that enables it to be sold in the European Union. For device class higher than class 1, you will notice there is a 4-digit number that appears next to the letters C and E, and these digits identify the notified body. As there is currently an ongoing recertification of notified bodies, according to the MDR requirements, there are expected changes in the numbers. Many of the so far existing notified body will not undergo recertification. They will no longer function as notified bodies, so you will most probably have to update the number next to your CE mark. As mentioned at the beginning, this is the summary of safety and clinical performance. That is a new MDR requirement, and this is required for implantable devices and devices class 3, means high-risk devices, and the summary of safety and clinical performance, it's actually not considered labeling. However, I recommend, or I think it's quite important to mention it here because it can be actually, it has some similarities with labeling documentation, such as the requirement that it has to be translated into official languages, and the impact it has on labeling is that the web link to the summary of safety and clinical performance must be stated on the label or in the instructions for use. The post-market clinical follow-up, another important topic emphasized by the MDR. MDR in general pays a lot of attention to post-market surveillance. This means that manufacturer is obliged to observe the product as it goes through its life cycle while being on the market in order to monitor any side effects, emerging risks, and off-label use. And what does MDR say on promotional material and advertising? The thing is, it actually doesn't say that much, except that it clearly claims that it is prohibited to use text, names, trademarks, pictures, and figurative or other signs that may mislead the user or the patient with regard to the device intended purpose, safety, and performance. And this sentence actually emphasizes the importance of using the device according to its intended purpose. And this will be a huge challenge for some manufacturers and distributors, as it's not rare that devices are not being used according to their intended purpose, which is so-called off-label use. So the MDR sets clear limits to the device use according to its intended purpose. So on this slide, you see the so far designated notified bodies. Here you see 5. In the meantime, during the past 2 weeks, there are 2 additional added, which is BSI Netherlands and there is double exclamation mark services. So it's very likely that your promotional labeling and IFU will have to be updated by the information about your new notified body. And what does MDR say on human factors and usability? The information on human factors and usability is quite limited, but also quite clear. It says that in the labeling documentation, consideration must be paid to users' technical knowledge, users' experience, their education, use environment, and medical and physical condition. So what does that mean? The problem is that labeling is often written, in particular instructions for use are often written by experts with high level of technical knowledge, and the end user does not have the same level of knowledge and education. So this absolutely must mirror in the language. It must be a simple and comprehensive language and text that is easy to understood and follow up. When it comes to use environment, many medical devices are used in a high pressure environment, such as emergency rooms, operating rooms, or airplanes, just to name some examples. So if the user needs to quickly get and read the IFU, it must be off-held. It means he must be able to allocate the required information quickly, and he must be able to understand it. On the next slide, you see some of the medical device symbols, graphical symbols that are used for medical devices. And in this respect, the MDR says that where appropriate, the information supplied by the manufacturer shall take the form of internationally recognized symbols. Also here, the MDR refers to ISO standards. There is a number of ISO standards that deal with the use of graphical symbols. And I would recommend every manufacturer to review all symbols, whether they correspond with the international standards, and if they're, these symbols need to be explained in the instructions of use. There are also some new symbols introduced, such as the translation symbol that is already available on the ISO website, while the MD, the medical device symbol, is still under revision, as is the main ISO standard 15223 that deals with the medical device symbols. So I would like to highlight the need for consistency in technical documentation and in labeling. That means that, the information not only has to be consistent across the portfolio of your labeling items, but it also has to be consistent with technical documentation, because labeling is a substantial part of technical documentation. Just to highlight some of them: the product or trade name, description of the device, intended purpose and intended users, the intended patient population, medical conditions to be diagnosed, treated and monitored, indications, contraindications, and warnings. And as we are in the European Union, and this regulation particularly applies to European Union, I would like to highlight the language requirements. While in several sections of the MDR, you will get the information that labeling information must be provided in an official union language determined by the member state. This still leaves some space for interpretation. It could still be that the member state will stick to one of the main languages, such as English or German or French. However, I would rather expect that the member state will explicitly ask for local languages in order to ensure patient safety.
Marketa, thank you very much for all these explanations. We see that the Q&A is already quite vivid. We will return to the symbols, but also we would like to be in exchange with our audience and would like to raise a poll question. So everybody is requested to participate. I will open a question now where we would appreciate your feedback, and the question is: when it comes to the final review of your IFU or other labeling items prior to printing and publishing, how do you ensure an error-free final version? The first option that may be taken is: our proofreader manually performs the last review cycle. The second option would be: there is no final review. Every stakeholder is responsible for the section according to the area of expertise. Or we use a software to proofread and verify the final version. So you're kindly requested to do your choice. And at the end, I will summarize everything so that we can profit from each other. For your information, there are more than 150 participants. So it's going quite vivid, and I will give it a few more seconds before we summarize. Yeah, plenty of you have already been answering, and the return was for the first question that the proofreading is done manually by 34% of the audience, and the other ones where we had also a lot of return on was that companies are using a software to proofread. These is about 33%. Thank you very much for your participation. Since we have still some more information we would like to exchange, I return now to Marketa.
Thank you, Jutta. So I would like to share with you the following slides that shows the actual update and a review process in single steps. So on the left side, you see the first window that demonstrates the first step in your process towards labeling compliance, which is to define or capture your labeling portfolio. You will have to go through all the labeling items you have and be aware what actually labeling, the term labeling in your company covers. This is also a good point to consider and prioritize timelines based on the volume of your labeling portfolio. In the second window, the second step is to define MDR requirements according to a product portfolio. So you can evaluate whether you have implants, whether you have electrical devices, the class risk you have, and based on that, you know what the MDR requirements are, and you will detect how to implement them into your labeling. The third step demonstrates about some steps that every organization struggles with, and this is actually the review of your labeling items. There is no way around it. If you want to have 100% compliant and error-free labeling, you will have to review every labeling item. This is also a good opportunity to create a gap assessment that may serve you to create templates for the future and to sort of detect what is the missing information, and whether you can develop somehow generalized approach based on the gap assessment. The fourth window is the actual revise and update of your labeling items, and once you have updated your labeling, you move into the review life cycles, and this is the blue window, and this blue window is particularly highlighted because this is a great opportunity for the use of TVT. At this stage, TVT can be very helpful when you start comparing your previous and current versions. You can also start comparing different labeling for different devices. That there might also be things and information that will become obvious and that will help you to standardize your labeling. So based on my experience, this is a point where I really compare a number of labels and versions with TVT help. that will finally help you towards MDR compliant labeling. The blue window, the window that demonstrates multiple review cycles, is further elaborated on the next slide. And this is to show you how actually the review cycles go and how you can use TVT in these cycles. So once you have created your content or updated your content that is MDR compliant, you will have stakeholders who review it. I would not recommend one person reviewing and deciding whether labels are compliant or not. I would rather recommend you to involve multiple stakeholders according to their area of expertise, such as medical, clinical, regulatory, marketing. They all have their expertise and they all can effectively contribute to the content of your label. The challenge will be that they will provide a number of comments and you need to capture these comments and implement them in your labeling. And this is another opportunity where TVT can be very helpful in ensuring that all relevant comments have been correctly implemented. And this is also a point when I usually compare previous and new versions. So yeah, in this respect, TVT is very helpful. Once you have implemented the changes from your first review cycle, you can move on to the second review cycle. And in the second review cycle, you usually have less comments. Usually it's in a pretty good shape. If you are reviewing extensive and complex content, you can even add a third review cycle. And again, the changes here, although they are minor, there can still be big mistakes that happen during the operations with the document. So another TVT comparison cannot hurt at this stage. And once you have ensured that all changes have been implemented, you can move towards the approval.
Thank you, Marketa, for explaining about how tedious proofreading task and update of the IFU can be. You have been addressing the text verification tool. This is a tool that helps comparing different documents. It very quick verifies text, images, graphics, and symbols in different documents and can compare them. And it compares them for different file formats and layouts. So for example, Word and PDF files can be compared, and these documents even may have a different layout and reading structure. Also, Excel files can be loaded and a lot of other common documents. The proofreading of this software can be done with any language. And of course, it is regulatory compliant, so a compliant audit trail is available through the tool. Now we would like to open for the questions. We already received some throughout the whole presentation, and one which I personally found very interesting was with regard to the symbols. When using a symbol and explaining in the IFU, is it necessary to reference to the standard where the symbol is taken from?
According to my knowledge, it is not a regulatory requirement to reference to the standard, but it can be very helpful for whomever is reading the IFU. It might also be helpful for your auditor, and there's actually a wide number of ISO standards that introduce graphical symbols. The 15.2.3 is the main one. However, depending on your product portfolio, there can be quite a number of symbols that you would need to reference. You can do so, yes.
Okay, thank you. A question with regard to Article 32. Summary of safety and clinical performance, is it required for Class 3 implantables?
It's required for implantable devices and Class 3 devices, high-level risk devices, yes.
Okay. And we have had questions with regard to language review of Arabic and Hebrew. This probably is related to the proofreading software. The text verification tool can proofread Arabic and Hebrew. We put a lot of effort into these right-to-left languages. So with the text verification tool, you probably could proofread them. Another question which came up was with regard to when companies create their own symbols. Do they need to explain them on the IFU?
Yes, they absolutely have to explain them, and it is allowed to create own symbols if there are no internationally recognized symbols that apply to your product portfolio. You can absolutely create your own. However, if I would carefully think about what the symbol looks like and to make sure that it's not mistaken for any other international symbol, and you absolutely must explain this symbol in your instructions for use, because it will not be obvious for the user what the symbol, or most probably it might not be obvious for the user what the symbol stands for.
Mm-hmm. Thank you. According to your experience, actually, what would be the biggest challenges when it comes to the IFU updates?
Based on my experience, I consider errors the biggest challenge in IFU updates. Errors can happen very quickly when we are working with, whether we are working with complex or small documents, whether IFU or a simple label. The information in both is very complex, and it is usual that multiple stakeholders review the content, and depending on how they comment on it and who collects the comments and who is responsible for the overall content, mistakes are very likely to happen. So this is another opportunity for TVT use in order to avoid mistakes and to ensure an error-free labeling document. Another challenge I see when dealing with IFU updates are translation challenges. Sometimes whole IFUs get translated, sometimes only parts of the text get translated, and even though organizations and companies, medical device companies, often outsource translation services, there is still a responsibility by the legal manufacturer for the content, and we are all human beings and we all make mistakes. So I would here strongly recommend, or this is also something I often do, comparing the version I send to the translator with the version I receive from the translator. So this is for sure a challenge, and maybe also graphics and figures that get somehow lost on the way during reviews, during updates, when graphic designers work with the files and work with the graphics. So this is also something where TVT can be of great help, detecting graphics, comparing graphics, and ensuring that previous and current versions are consistent.
Okay. There was one more question with regard to reporting possible incidents, and is it necessary to add a note to the IFU which requests the user to report any possible incident to the authority or the manufacturer?
Yes, it is a requirement, and I mentioned it on the IFU slide. You must absolutely provide a note in your IFU what to do in case of an incident, and the incident must be reported to the legal manufacturer, but also to the health authority.
Okay. I see a few more questions coming with regard to languages, and I think this is related to the text verification tool. With regard to languages, as mentioned, it does any main language of the world, so also languages like Japanese, Chinese, Greek, or Russian. We are happy to tell you more about the text verification tool, but for now, we would like to come to the end to our webinar, and if you would like to have more information about the text verification tool or consultancy, we are happy to help you with regard to the proofreading solution with a software that for sure will reduce your proofreading time and create consistencies over all documents. Here, Schlafender Hase, our company, is the specialist, and you may want to contact us through the email address on this slide. With regard to product labeling and packaging, Maketa Nabiani will be happy to help you. She is on LinkedIn. And you see also her email address stated here. She's very happy to support you regarding IFUs, patient and user documentation, or any promotional labeling material. Thank you very much for spending the time with us. It was quite interesting. And I also would like to thank Maketa for preparing all this valuable content, and wish everyone a nice day. Thank you very much.